Hi, and welcome to Birthing Conversations, which is a platform for conversations around healing, birth, postpartum, perinatal, and all things that we would really want to talk about, but we don't. So, on today's episode, our guest is Yisroel Isaacs, the CEO of Essence Mental Health and a licensed clinical social worker. So hello, Yisroel.
Hello. It's so good to be here.
Good to have you here.
Yes.
And if you want to tell me a little bit about yourself and where is your interest in Sparks, which we know each other for many years.
Yes. And I can share that story if we have time of the first time we met. Okay, so I'm a licensed clinical social worker. I've been practicing since about 2013, so almost 10 years. I've been the director of multiple mental health clinics over the last, since 2015, so the last 7 years.
Well,
And I've met many different social workers as a director, and I think I know social workers. Yeah. So
yes, you do.
yeah.
I can say that.
Right.
And you know your work.
Yes. And right now, I'll take a moment to talk about Essence. Essence helps social workers with their best practice in everything. It helps them with everything they need to practice clinical social work. So and have their private practice. So if they need a space, they need a receptionist, somebody to do their billing, clinical supervision, trainings, marketing, any social media support, anything that they need to help them build and maintain their private practice, that's what Essence does.
And also on a clinical level.
Right. And
which is
yes,
something that I have a big interest in because I want to have a little clinical conversation with you.
Yes.
But maybe before that, if you want to say, how do we know each other?
Okay.
What's your connection to Sparks?
So many years ago, a mutual friend of ours approached me to help them with their fundraiser. And at the time, I didn't know much about postpartum depression. And usually when somebody asks me to help them with a fundraiser, I don't necessarily hop on board. But when I heard about everything Sparks does, I really jumped in to help because I felt like this is something that is so important. And at the time, I was the director of a clinic, and I had a lot of patients that only after us having a conversation did I realize that this is what they had. And it wasn't your typical depression. It wasn't just baby blues. It was something, real that they were suffering from.
Yeah, and in what way did you see the difference as you are dealing with, in general, with mental health and with so many social workers and mental health counselors? So you see so much and being a supervisor to all of them. So if you can tell me more from your point of view, what are the differences that you see when it comes to perinatal health, to regular depression and anxiety and so on?
So first off, what really shocked me was the numbers of how common it is. So working, especially with the Jewish community that has a lot of births, a lot of pregnancies. So statistically, I felt like there was really something there. So that just from a numbers perspective, I was able to see there's for sure something here. But then also I had, in clinical supervision, I was working with social workers and or even interns or whoever it was, and they were telling me okay, I'm using this technique, I'm using this therapeutic technique that we discussed or I learned or I did a training on, and it doesn't seem to be working. Right. And then I realized hey, wait, there's something, maybe there's something more that we should be educating the social workers on, that is, that they may have never heard of, or they just don't know how to treat. So
Correct.
that's when
for some reason they do not, and I hear this over and over from social workers, that It's not an education they get in social work school.
Right.
They don't talk about it.
Right.
They maybe mention it a little bit on the tippy toe, but they do not speak about it as something so real and in such high numbers, like
Right.
you said, and the intervention that it needs,
Right.
which is interesting to me.
Exactly. And recently I was at the Aguda convention, and there was a conversation. There was many conversations about therapy and the Jewish world. And one of the questions asked to a panel of therapists and rabbanim was, it was actually to a referral agency of what they're looking for in social workers, of who they refer to. They asked what are some good qualities a therapist has, and then like he was going to take a moment to like ask everybody else, and they didn't call on me, but the answer that I had and that he answered was a student, just always being a student, always learning, just always getting the latest information, just to be able to be
I
there.
like that.
Yeah.
I would even add on that it's okay not to know everything.
Right. Yeah, and that was eventually that answer was also said like that was the exact example where they said, if you get a referral to a client and say, do you know how to deal with A, B, and C, and you don't, please say no, but I will find somebody that does A, B, C. I
Correct.
only do X, Y, Z. And in the meantime, learn A, B, C, so the next time they call or somebody else calls, then you can say yes.
Yeah. I totally agree with that, but that's not always so easy to do. So
Right.
it takes a lot of the person, but that's the real way to deal with the situation.
Yeah, some other qualities was humility and being humble. Like one of the people on the panel said that he hears a lot of social workers say, I think this and I say that and I wrote this. And it's like maybe a little bit more humility, like, in my opinion, this is what I think,
This is
but
from
I could
what
be
I
wrong.
know.
This is what I know, because every situation is so different and unique.
Correct.
Yes.
It's so much not a one size fit all.
Right.
So going back to postpartum depression, so when you mentioned before that you realized that therapists would come and talk about a situation, in what way did they find postpartum to be different and they felt that they're not educated to deal with it? How did a scenario look like different than a regular depression from your experience?
I don't have the one answer for this. It was very nuanced, but there were, I guess, a couple of factors. There was the whole hormonal piece, where they I guess didn't the patient wasn't medicated or properly medicated. Maybe they took something that wasn't the right thing, and it just based on the feedback from the clients, there was no connection. There was no.
Yeah. So I think what I can elaborate on that is that hormones can be acting very extreme.
Right.
So even if we take to the most extreme postpartum psychosis as opposed to regular psychosis, they act very different. Because it's a hormonal disorder, the hormones really are whacked out and they act up in a very different way. Also, there is a lot of different sensitivities that come into the picture, which is mom, her own self-esteem, the way she sees herself as a mom, her husband, her marriage, her baby being so dependent on her. There are a lot of other factors, except for the clinical side, which is definitely very, very hormonal.
Right. So the question I actually have is, despite all the limited knowledge I have on postpartum depression, because I'm still learning, right? So what I think could be valuable is something we touched upon earlier, where the social workers for sure have in their caseload people, women with postpartum depression or
For sure.
or anything in that whole category, and they think that it's something else and they're treating it not the correct way. So what are some things that therapists should look out for? I mean, you just mentioned it, but maybe
For that, they need to come to a training.
Okay. So
they need to come to a training.
But maybe a sneak peek.
But just giving you a little example, we had this very, very horrible story a couple of months ago about a mom that was like throwing her baby out from the window because she was so manic. And now that I know the case from close, good woman, good mom.
Right.
So that day that this happened, she was seeing a social worker and she was giving her symptoms. She was sharing.
Right.
And the social worker sent her home and said, "You're okay." And she wasn't okay.
Right, because let's go to the social worker's shoe for a moment, because in the social worker's perspective, if maybe something that they've been trained, they're taking a limited assessment where, like, what are their strengths, and the mom could be saying, like, oh, my family and my baby, and in a traditional suicide assessment, as long as you safety plan, things can be fine, but not knowing the additional factors of postpartum depression.
She was becoming manic, and
Right.
the social worker did not recognize the symptoms and the red flags
Right.
for becoming manic as a result of postpartum
and
psychosis.
And that's tragic, because
that's tragic.
How many times has this happened? And this was something that we know about. How many times this doesn't know about?
It happened many times, and each and every time I can say, when they called Sparks, they did not end up harming not themselves and not their child.
That's amazing. And
but when they don't, and they don't know, and that's why early intervention is so important. And it's they could end up doing things which is horrifying. But like you mentioned before, it is different. It acts different than regular psychosis. And the only thing I could say out of a training is that hormones is something very extreme, because let's move away a minute from postpartum depression. Let's move away from an anxiety and depression in general, right? Take a woman with PMS, right? And not severe PMS, not PMDD, regular PMS. You find so many girls, they're edgy, they're moody, they're angry, they're frustrated easier. They have all those hormonal symptoms, and they are not girls that have a disorder of an anxiety. Girls, women, I mean, moms,
Right,
it doesn't matter. Women,
exactly.
They do not have a diagnosis or a disorder of an anxiety or depression or OCD. And suddenly they're so edgy. Why? Because it is their hormones. So hormones act different on a woman. And women are blessed that their hormones are changing since they're very, very young until post-menopause. And even at that time,
and there's other changes.
There are still changes, because they're low in estrogen, and there are other changes that play a role. So just focusing on the fact, I think, that this is hormonal, even hormonal could be biochemical, of course, because all the neurotransmitters are being affected. It is still different. And that's why knowledge is important, as you said. Yeah.
And something that's coming to mind right now, because I've heard this speech multiple times from you before in different settings, and what's amazing is that the passion that's coming from you, and the sincerity, and just the, like, that you're not burnt out, and just the giving over this message. It's like the same, like I heard it the first time
I
years
feel
ago.
like screaming.
You're right, and it's just amazing, because I hear
yelling.
people like a broken tape recorder, like, and like I've said this before, like, okay, like, why am
you.
And here you're just saying it with just such clarity, and it's really amazing.
I'm ready to yell.
Okay.
And the reason I'm so ready to yell, because the path to healing can be so easy,
Right.
and so not complicated, if just the understanding and the awareness and the early intervention is there.
Right. So I think we have a clear understanding of what needs to be done, at least from what I'm going to be doing. Next steps is talk to schools to putting this in their curriculum. I have a relationship with many schools, just to kind of, and maybe we can work together on on getting that done.
Education.
Right? And then also so that's for the future social workers, and for the past social workers, just even if they don't want to deal with it, just some sort of education for them to know.
Say I don't know.
To say I don't know, to recognize what it is so they could properly refer, because this is so important, because it's really scary. I can name from the many social workers that I know that they don't know this information.
They don't. But let's go back a minute to general healing, which I can also relate to postpartum depression. Who in your eyes are the people that heal easier, are more willing to get help?
From the clients?
From the clients,
Right.
From the client's side. What's your experience?
Sorry, can you repeat the question one more time?
So my question is that you have different clients, right? And they come more willing to be healed and less willing.
Right.
Where do you see the differences? Who is more willing? Who is less? It takes a lot to heal.
Right. So there is definitely a stigma within the Jewish community, even within the community at large, a stigma to therapy, less and less every day. And within the Jewish community also less and less, but it still exists. So less family support means less willing and less helpful factors that help with their healing. So even if somebody's like, okay, I'm going to therapy, without the support, support. Okay, that's a good summary.
Yes. How about denial?
Right. So I guess specifically with postpartum depression, a lot of moms who I've dealt with, specifically in postpartum depression, they feel that I got this. I'm super mom, at the times that they feel that they could, right? So obviously when they're low and then they feel like the worst. They're not handling, but at the times where they feel great, it's good enough that they prevent themselves from having to reach out for help when they're like, this is normal, or they are, their parents or their friends have said, oh, it's okay to feel this way. You got this, we'll babysit the baby for a little bit so you can nap Shabbos afternoon, like simple, small Band-Aids that aren't helpful.
I like the Band-Aid part.
Right. Yeah. So,
I like that.
I mean, I guess Band-Aids is a term for healings, but you're not going to put a Band-Aid on something that, needs surgery.
Correct.
Right. So
you have to know how to, when to apply it.
When to apply it. So.
And Band-Aids are useful.
Right.
We need it in every home. Yeah. I make sure to have it on every travel trip.
Yes.
So.
Yes, it's packed in my bag.
Yeah, they can be helpful.
My daily bag as well.
Going back to denial, like within already the women that come out and reach out for help, do you find that even if they reach out for help, they can be reaching out for help just because they were told so, or because they're afraid to do otherwise, but within themselves they're still in denial, or you find more openness to healing? Except for the general comment that you made about mental health, that it's getting better every day, which I agree on that. But specifically about self-awareness, I guess, when I talk about denial.
Right. So denial is a huge factor, I think, in everything, right? People don't, they're the last ones to accept that something bad has happened to them. Not always, but a lot of the time. So I guess, they're wondering, like, I guess this is not happening. This didn't happen to me. I read about it, I hear about it, but I'm normal. I have no family history of this. It was fine for my other kids. There's, I'm generally not depressed, when I'm not having a baby, like for the last, 20 something years. So I guess denial is something, I actually didn't even think about it. Yeah, it's definitely something that can be a major factor in why they're not going for help, or even if they're going for help, they're like still on the fence. Right.
On the fence. How do you find husbands to be?
I've heard the same script from husbands all the time, where it's something along the lines of, I guess maybe it's two. I've heard two scripts from husbands where it's like, I can't take this anymore. It's really out of hand. It's like, oh my God, like this is the worst. she's crazy.
It's in her mind.
It's in her mind. Yeah. And then there's also like, this more supportive, but like very confused. Like, I don't know, this is not her. Like, it's almost like the same script, but like a different tone, where it's like, this is really not her. More lost. It's like, I don't understand. Like, I'm trying to be there for her. And I even had one time, like, I even asked my Rosh Hashiva permission that I don't have to go to Shir, to Kollel, to be there for her.
Tonight Seder.
Tonight Seder, or it was, whatever. That was actually, that was Night Seder. And they're trying everything they can, because a lot of times the women are taking it out on their husbands, which I think we should also talk about. So they
take it out where it's comfortable.
Right. That's what I tell them.
So I tell the husbands it's a compliment for them.
Right.
They should take it as a compliment.
Right.
It's not that life should be going on this way. Of course, it needs attention and care.
Right.
But just, can you put that wall up where you don't take it in on a personal level?
True, but then sometimes they're dealing with their own stuff.
Yeah, postpartum for husbands.
Right. And then also, like, what if the mom has other mental health issues, that it's not just during pregnancy and postpartum that something's going on, that it's an ongoing issue for them, and now this is just like the straw that is breaking the camel's back. So that's also something that I've had to deal with. Yeah. But for the most part, as a summary of the husbands are lost, I think that was a good word to say.
And that's why I'm very encouraging also for husbands to get help. The husbands need help. They also need to fill up their gas tank. They need fuel. It's so much for them to deal. Never mind the fact that becoming a father is also a big responsibility. Right. And it's also a big transition. And not too many people talk about that.
Even in the best case scenarios where mom has a baby and there's no postpartum depression, that's a major life transition in itself for mom and dad.
For
obviously
both.
A little bit more
and
for
their
mom.
Man, and for their marriage.
For their marriage, for their relationship, it's a next step. So you add this to the pot. It's
right.
Yeah.
What would you think is the biggest challenge for the husband from their coming to you as families that are in need?
Shame, failure. They're supposed to be the rock. They're supposed to be the macho. They're supposed to be the ones that are to keep it together. They're the ones who they didn't push the baby out, but so they should have no excuse of what's that something's affecting them. But obviously,
it's hard. It's even hard to understand that if it's not hormonal, it could be psychological.
Right.
And the psychological part is still there.
Yeah.
Yeah. I had just last week a very sad case where the mom, besides of her becoming manic, there was history that the husband did not know. And
it triggered it, activated it.
And the mom herself, she wasn't on medication, but was enough to be more aware. And there was not that awareness. And here I'm listening to a young husband that is crying and is so devastated for also feeling like he was fooled. He was fooled into a situation that he was not ready for. And no one fooled him intentionally. But it's just those dynamics of all of a sudden putting together pieces of the puzzle and looking back at history and seeing symptoms that are severe enough to say, here is a risk factor here of having a baby, because there are risk factors.
Right.
So going back to who is a better candidate for healing, you're saying the awareness is mainly what it is.
Awareness, support.
Hard work,
putting in the work, commitment to the sessions.
Do you see the commitment?
Yeah. No, I'm like thinking, I'm going back years, so it's like I don't have all the cases in front of me, but yeah, I think especially the cases that came from Sparks, that they had a case manager to help them in between sessions. That was also a major
The support
the
between.
support between the sessions. Yes, Sparks has a case manager
Yeah.
that is on top of the cases and communication with the therapist and the client and every moving part. So it's definitely helpful and helps with the commitment. I would just imagine where they didn't have that follow up, that follow through, that communication, where they would just feel
The
lost
fo-
and
the follow-up
alone.
is a big one.
Yeah,
And even for husbands, I would love for husbands to have more than what they currently have. And husbands is a big one. And like you mentioned, the night seder or asking the Rosh Yeshiva or the Rav reminds me of Rabbi Twersky sharing so many stories where he would say that he would get calls and he would be asked, and if it's not an Ein Hara that happened,
right.
because baby people are jealous, or he said he even had calls from very naive and young husbands that they would say they maybe have to increase their learning and saying more Tehillim so things would improve quicker. And he said, I have nothing against increasing learning, he would tell me, and it's a good thing, and saying Tehillim if you have the time, not on your wife's timeline, but it's not about that. It's something real.
Right.
And it takes a lot to have that courage to come out and ask for help and actually takes the steps to heal.
Correct. I actually am remembering a case that we dealt with where this young couple got married with the agreement of she would work maybe 2 jobs, and he would sit
Impressive.
and learn. Well, maybe no, it was a job. It was school and a job, so it was just kind of full, and he would learn in Kollel. And it got to a point where it was really, really tough on her, and he didn't. Sorry, it was tough on her, and she got pregnant, and it was really tough on her. And she asked him, maybe you can
Take a job.
take a job, take a little, some learn part-time or do something to help with this new dynamic. And he spoke to his Rosh Yeshiva, and his Rosh Yeshiva said no, he should learn. And
Gets me angry.
It was just frustrating. And he would come home during the day and just take a nap and just kind of and expect her to make lunch for him or something, and then he would go back to Seder. And she eventually had a miscarriage, and just from the stress, and it was just a whole.
I'm glad she didn't become manic from the stress.
Right.
Just a miscarriage is good.
Yeah. Ultimately, they divorced.
They divorced.
They did get divorced.
I'm not surprised.
Right. Yeah. So they got divorced. He was not supportive for her needs.
Yeah, which I really want to try to give him some, a benefit of that, and say that he was so uneducated,
right,
that he was so stuck.
Yeah.
So again, we're coming about developing awareness, mental health, well-being, emotional well-being, understanding all that, counseling. It doesn't always have to be to deal with something which is so black and white clinical. Right. It's okay if it's dealing with some grace.
Right.
Gray is okay in life.
Yes.
That's what I see. Tell me what you're thinking.
I'm gonna have to agree. I can't really add to that. It's right on the nail.
So why not? Why learn the hard way?
Right. So education.
And again, education.
Yes.
So Yisroel, talking so much about education and support today, and tell me what your take is on this. I think education is so important to rabbis, to community leaders, to mental health professionals.
Chassan Rebbe's, college teachers.
Everyone that's involved with the well-being of a family.
Right.
Because there are so many parts to it.
Exactly. It takes a village. Right. And maybe even on a higher state, on a larger scale, where governments. I know that you work a lot with the doctor offices, but
correct.
What are the grants and services available for families that are dealing with postpartum depression?
Postpartum, similar issues.
Yeah, everything family perinatal. Yeah.
family well-being. I always say that when the ocean is wavy, a lot of garbage comes out.
Right.
So
Yeah.
it's a perinatal case, yes, but then
Right.
we find out that the marriage needs some help. Children struggle with other issues
Right. The
that
rest of the
can be
family.
related. The
Exactly.
rest of the family.
And I know for the last, I think 16 years, 18 years
Of Sparks?
of Sparks,
16.
16, that this is what you've been doing. And it's amazing. And despite it being 16 years, it's unfortunately there's a lot more work to do. And
I wish it wouldn't be.
right. Yeah, and here we are, episode 3 of a podcast that will be shared, and people will watch and listen to understand until everyone knows the message.
What's the message as a clinician that you would like to
So
end this
okay,
episode
so
with?
for the clients, it's know that the social workers and the therapists and the healers and the I guess, yes, the healers are here for you to help you through this time, and it's just temporary, and you will have the rest of your life with your precious baby, with a healthy, happy relationship, getting the proper help.
Amen.
And for the healers and the social workers and the psych providers and everyone responsible for helping those said clients, do the work to be able to help them. Picture that family that you can have an impact on to help the mom and the baby bond. To help the whole family have a happily ever after.
I agree with that. I agree with that. To the client side and to the side of the helpers, educate yourself and don't get involved in something you don't know.
Right.
It's okay to say, I don't know enough about it.
And then get yourself educated.
Yeah. If you're a mental health professional, if you're a rabbi, it doesn't matter who you are and what you are. It's okay not to know, but to give advice or to help when you don't know what you're doing, to me, that's a crime.
Right.
So
yeah, it's malpractice. It's really unacceptable.
No matter which,
it's not ethical. It's not legal. It's not good practice.
It's not good practice for whatever role you take in this. So and yes, to all of you listeners, there is light at the end of this tunnel, and don't struggle in silence. Reach out, and we are here. Yisroel has a team. Sparks is here. We're all ready to help and be helpful to you and your family. Just hang in there. You will all be okay. So thank you so much, Yisroel, for being here today.
Thank you for having me.
It's been a pleasure.
It's always good to see you.
Same here. And wishing you a great rest of the day.
All right, thank you. You too.